Hi folks, I'm John. This is Nikki.
Today we're doing a video on our intro to IVF. We're going to talk about why we're doing it. We're going to go through all of our pre-testing that we have to do beforehand and all of our consultations to get started. This is going to be a super informative video leading all the way up until egg retrieval month. So everything kind of from before that all the way up until we actually start IVF.
We're also going to touch on what led us to the decision to do IVF.
Yeah, so we'll kind of start there. So we currently have 4 children. We have been very happy with our family, but we found out that we were expecting one more child and we were scared at first. I think it was scary at first. We're like, oh wow, 5. But then we quickly embraced it and got very, very excited. And then unfortunately I had a miscarriage. So that was kind of hard because we got excited about a life with 5 children, kind of started to envision everything, and then had it taken away.
Started making some remodel plans and just kind of figuring things out and trying to get everything organized and just really making a plan and a detailed plan of how life was going to be moving forward.
Yeah, so it definitely hit hard when we found out that we miscarried. I think we were both pretty hurt and it was hard to deal with. And I think that we quickly realized that we still wanted one more child, but knowing that I'm 40 years old, there's also the risk of, everyone kind of knows like the risk of Down syndrome, but after looking into this more, there's a lot more trisomy, like chromosomal issues that happen after the age of even 35. So just knowing that risk, we kind of decided that IVF would be the way to go so that we can do what's called PGT testing to kind of make sure that the embryo has all the correct chromosomes and everything looks good. It's not creating like the perfect baby by any means, but it's just saying that at least the pregnancy it should be viable if all the chromosomes are kind of the right way.
It's been an exciting process, a lot of doctor's appointments, a lot of testing, a lot of stuff leading up to it. It keeps you busy, keeps you on your toes, but no more than another child to bring to the picture. So definitely something you can navigate.
So follow along as we go through this journey of getting started. Testing month. So I did blood work, cultures, and an ultrasound. John did his semen analysis, and then we did a carrier screening, which I like to call the spit test. You spit in a vial, mail it in, and then they check to see if both of us are carriers for the same things. The CIS, which is a saline ultrasound, and then the hysteroscopy, which I do have a little bit of pregnancy tissue left, so they're going to scrape that and get it all ready for transfer later. Hi guys, ignore the crappy video here. I just got done with my hysteroscopy and D&C, so just kind of resting. I'm super groggy after the anesthesia from that. But everything went well. This was the last step of all of my testing, and we are good to go now.
So we're currently waiting for a consultation call with CNY.
We were on their wait list, and we actually got lucky that we were able to bump up our consultation to today. However, we have our 2-year-old. Our original consultation was scheduled during her nap time, and this one is not during nap time, so we'll see how this goes, but we are anxiously waiting for this phone call. Hello.
Hi, this is Nicole.
It is.
Hey, Nicole, my name is calling from CNY. How are you?
Good. John is here also.
Hello, how are you?
Awesome. I am good. How are you guys?
Great, thank you.
All right. Well, we are going to go through and just verify y'all's information and then kind of talk about treatment options. But just kind of tell me what brings you to CNY.
So I'm 40 years old. So given kind of the euploid versus aneuploid statistics, we kind of wanted to go the route of IVF. So our main focus is PGT testing. We recently had a miscarriage and decided that we want one more child, but we want to do it with the testing.
Okay, I gotcha. Okay, well, we can definitely do that. Did you have a location in mind?
Yeah,
that you
so
want to visit?
yeah, so I was originally planning on Buffalo, but I heard that they don't do PGT for travel patients. So like we were kind of thinking maybe do retrievals at Syracuse and then do like pay to have the embryo possibly move to Buffalo to do the transfers in Buffalo. It's just a little bit closer of a drive.
Yeah. Okay. Yeah, for sure. Yes, that is correct. So that's why I asked, because almost every Ohio patient wants to go to Buffalo. So I just go ahead and ask because I'm pretty sure that's what you're going to say. But,
Yep, exactly.
okay, let me verify your info first, and then I'll verify John's. I have a delivery in 2008, ectopic 2010, delivery 2015, delivery 2023, and then the one miscarriage.
Correct.
Okay. And your most recent period I have is October 29th.
Correct.
And your periods are regular. You never skip a month or anything.
Correct.
Like that.
Yep, they're pretty 26 days to the day, like every month, very consistently.
Okay. Okay.
So a little bit shorter than normal.
Yeah, but it's a little shorter, but not too bad. And then your most recent pap smear and mammogram, were those both normal?
Yes, they were.
Okay. And have you ever done fertility treatment in the past?
No, we just kind of started our testing month at a local fertility clinic, and then we decided that we kind of wanted to switch to CNY for the actual like retrievals. But other than doing testing with a local clinic, we haven't done anything.
Okay. And as far as medications go, I have all the supplements you're taking. Are you taking any prescription medication?
No.
Okay. And have you had any surgeries in the past?
Yeah, quite a few. So I had appendix in 2003. I had I was born completely blind in my right eye, so I had an eye surgery for that in 2010, maybe 2011 actually. And then I had hernia surgery last November, and then I don't know if this counts, but I just had my hysteroscopy this month. It's anesthesia,
Okay,
so I figured it.
Yeah, all of that for sure. The hernia, was that an inguinal or umbilical?
Both actually, but done at the same time.
Okay.
And I do have a mesh from that also.
Okay. And then, was there any findings from the hysteroscopy that they did?
Nope, everything was good. Because of that recent miscarriage, there was like a little bit of pregnancy tissue that they took care of. But now everything's good. There was just a tiny bit still left.
Okay, gotcha. Okay, and then do you have any drug allergies at all?
Yeah, quite a few. So IV contrast, like what would be used in like a CT scan, for example. Codeine, so I can have Tylenol, but not Tylenol with codeine, obviously. And then Sudafed or pseudoephedrine.
Okay.
And then I also have a shellfish allergy and a gluten allergy also. So not really medicine, but worth noting.
And then, do you smoke, drink, or use marijuana?
No.
Okay. And then, what about John? Do you have any drug allergies?
No.
Okay. And y'all have one child together?
Correct.
Okay, is that your only child as well, John?
Nope, he has
No.
one other.
Okay, so one together and one prior.
Correct.
Okay, and then any health problems or any medications that you're taking?
No.
Okay. Any past surgeries for you?
Appendix in 09.
Okay. And any major family history for you?
No.
Okay. And then, have you ever had semen analysis before?
Yeah, he just had when I uploaded that into. I actually put it into my chart at first and then realized that I could put it in his, so it's in both.
Perfect. Okay, and then John, do you smoke, drink, or use marijuana?
Occasionally drink.
Okay. How many drinks, like, per month or per week?
6 or 7.
Stop. It's more than that.
Per week?
Yeah.
And then you said you're going to do local monitoring. It's like close to home, is that right?
I actually want to do the SAMA monitoring. So I actually had my consultation with them last week, and I'm really excited to kind of just go that route if I get approved to do that through them. But yeah, otherwise it would be local, but I'm hoping I can do the SAMA.
Okay. So that'll be for ultrasound, so you will still need to find somewhere to do the blood work.
And that would just be at like a local lab.
Okay, got it. All right. So I'll upload a couple documents to your chart. One of them is just a list of our recommended supplements. You're probably already taking them all, but just look over it. And then I'll also upload an IVF timeline that will just kind of tell you what to expect with IVF. Your AMH is on the lower side, so that's the only thing that I see that could be concerning. Just because, so say we start out with, these are just made up numbers, but say we started out with 10 eggs. So of the 10 eggs, only like 8 may be mature, only 6 may fertilize, and then they have to grow for a week to be able to genetically test them. So, you know, if we let them grow for a week, we may only get like 3 embryos. And then once they're genetically tested, it needs to be a normal euploid embryo. So just keep that in mind because your AMH is on the lower side. I don't know, do you know what your antral follicle count is, like on ultrasound? Have they mentioned that to you at all?
Yeah, so they saw 7.
Okay.
So that's pretty low.
So that's like
also.
potential, yeah. So that's like potential for 7 eggs. So, you know, if you get 7 and, you know, obviously we can hope that they're all mature and all fertilized, but there's usually attrition at each step. So, you know, likely we would probably get like 1 or 2 embryos. And so just keep that in mind that it may take more than 1 round to be able to get a normal embryo.
Yep, and that's something that was actually one of my questions for you today is kind of if we're able to do 2 retrievals like 2 months in a row, like obviously like a second cycle, but like do a retrieval like let's say in December and then do a retrieval in January, like kind of send the first set off for testing, if you will, and then do a second retrieval, like plan on it without even waiting, I guess, and just kind of assume we're going to need at least 2 retrievals.
Yeah, so we can do that. We would just call it embryo banking.
Okay, yeah, that's what.
And then as far as that IVF timeline goes that I uploaded, I'll go over it with you. We'll go in for the blood work and then do the ultrasound every couple of days to see how your body is responding. And then when you look ready for egg retrieval, you'll do what's called a trigger shot, and that will trigger the eggs to release, and then egg retrieval will be about 36 hours later. So if you trigger it on like a Tuesday morning or Tuesday night, your egg retrieval would be Thursday morning. So we really can't plan an egg retrieval. Like, you know, I can't say like your egg retrieval will be January 10th because it really depends on how your body's responding. So some people it may take 8 nights of injections, and some people it may take 15. So it really, really just varies. So that's why we do the frequent ultrasound and blood work.
Makes sense.
So that's kind of what to expect leading up to egg retrieval. On the day of your egg retrieval, you'll do, you will have anesthesia, so you will have light sedation. That morning, John will leave a sperm sample, so that will be ready to inseminate the eggs. As far as egg retrieval, you are just asleep, usually like 10 minutes. It's very quick. We'll go in vaginally to get the eggs, so there's no outward incisions, kind of like a hysteroscopy.
Yep.
And then we'll know that day how many eggs we get, and then about a week later, we'll know how many embryos we have to genetically test. So we'll know what the starting point is, and then we'll know how many you get. As far as the back-to-back cycles, as long as your body goes back down to normal and everything looks okay to get started again, we can do that. It just kind of depends. So obviously, we're going to try to get as many of your follicles to grow as possible, but it's not like they necessarily just go like immediately back down, you know? So as long as everything looks optimal, then yes, we'll let you go ahead.
Okay.
As far as the transfer goes, it is pretty much done like a pap smear. They just insert speculum, put a little tube through the cervix, and insert the embryo into the lining. That's probably the chillest part of all of this. So
Right.
no sedation, nothing. It's very quick. So that's kind of what to expect. After this call, your next step is going to be a call with a nurse navigator.
Okay.
As far as when you'll get started. So we don't do PGT testing for like 2 weeks in December. So likely egg retrieval would be in January for you.
Yes.
You wouldn't want to go through and like freeze the embryos and then thaw them later for genetic testing and then refreeze
Correct.
them and then pre-thaw them for transfer. So likely we'd be looking at around January to get started.
Yeah, so my next
all of that is tentative.
Yeah, so my next cycle is kind of looking at like not my next one, but the one after that would be like December 20th. So that's kind of the cycle that I was kind of aiming for, and I wasn't sure how that works with like New Year's Eve closings or something, but ideally like that December 20th is kind of where I was hoping to start, knowing that you guys don't do PGT the first 2 weeks of December.
Yeah, so whenever you talk to the nurse navigator, they'll kind of give you further instruction, but likely you'll call that first day of your period.
Okay.
And, you know, either hopefully just go ahead and start medication, but they'll just kind of let you know at that point.
Okay.
And then, like I said, you can reach out to financial whenever. So look at our website. On the main homepage, there's a family building guide, and it just talks about everything we talked about today, just even more in depth. So I would definitely take a look at that.
Okay.
And then any questions you think of between now and your nurse call, I would just make a list, and they can help answer any questions that you have. And you can also probably find a lot of answers on the website as well.
Okay.
And then we'll get started with the priming and everything.
Okay, perfect.
Little bird.
I appreciate everything. This was very helpful.
Yes, Mom. So everybody's always so nervous, but I'm like, I'm just one of y'all. So nothing to be scared of for now.
Awesome.
I wish you guys best of luck. If you need anything, best way to reach us is through the portal. So just send us a message, and then we'll plan to talk to you soon. Okay?
Sounds great.
Thank you
so
very much.
Okay. You're welcome. Have a great rest of your week.
You too.
You too.
Thank you. Bye.
Bye. Victoria was trying to run circles around the camera. Say bye.
Bye, Daddy.
Okay. I think it went well.
Yeah. So today we have a call scheduled with the nurse navigator from CNY. We're getting ready for that. That call should be coming in any minute now.
I'm excited. Oh, hello.
Hi, is this Nicole?
Yes, it is.
Hi, this is one of the nurses from CNY. How are you?
Good. How are you?
I'm good. I wanted to reach out to you after your consult yesterday. I'm one of the nurses that works with the nurse navigator team. So what we do is we go over pretty much what the provider had suggested. There's a few pieces of information we get just to kind of complete your chart on our end. And really just to kind of, I guess, discuss things so that you kind of know for sure what the next step should be. That's all right.
That is perfect. John is here also. I forgot to say so at the beginning.
Oh, that's okay. That's all right. The first thing I wanted to start off with, which I'm going to say we may or may not ever need to use, but we'd like to list a local pharmacy in your chart only in the event, let's say we had to send something like right away for you to start, like an antibiotic. What pharmacy would you want us to list?
Yeah, it's the CVS pharmacy in.
Make sure I get the right one in there. Perfect. Like I said, we may not ever need it, but if we do, it's there. The next thing I like to go over is options as far as finding out more information about anything financial. Okay, as a nurse, I can't speak about benefits or costs. I don't know that as a nurse. Just like financial wouldn't be able to help you with medical things. Whatever questions you have either about insurance coverage or cost of treatment, etc., we can either look to get you scheduled in with financial where they would call you on the day and time we pick, or if you prefer, you can send them a web message. The only thing I'm going to say is a little bit of a setback if you want to speak with them with an appointment. For whatever reason, right now, their first available is December 9th.
Okay.
I'm not sure why. I don't know if it's part of that is Thanksgiving. I don't know, but so that's why I want to go over options, because that may work for you, or you may say, I want to find out some things sooner, and that way you can send a web message. So I just figured I'd ask you guys what you prefer.
Yeah, no, web message is definitely easier, I think.
Okay.
Especially if it's
That's
easier for them too.
And we're a self-pay, so we don't have any insurance or anything.
Yeah, it's going to be payment
So-
plan, but self-pay.
Okay, so yeah, just you can send them, that's fine, you can send that to them. All right, so let me see here. I didn't upload consent forms, why is that? Let me just, when I did chart prep first thing this morning, I just want to see if I was just unsure what type of cycle you were planning. Are you planning IVF?
Yeah, so we want to do egg retrieval with PGT testing, possibly 2 egg retrievals before we even get to the frozen embryo transfer, just given my age and waiting for a euploid. But eventually the goal will be retrievals leading to a frozen transfer.
Okay, so I don't know why I neglected to put your consents in this morning, but I'm putting them in now. What that just means is consents would be the only thing we would ever send to your personal email.
Okay.
Everything else would be in your CNY portal, so there wouldn't be a question like, oh geez, did they send it to my email or my portal? The consents are the only things that go to your email, and that's only because that's the way you can electronically sign them. So they would first go to you for your signature. After you sign them, then they would forward to John for his signature.
Okay. Got it.
So I just put those through now, and it'll say CNY Fertility signature required.
Okay. I do see the email came through. Do you need me to do that before we proceed, or do you just want me to do it later?
Oh,
Okay.
no, because there's several forms.
Oh,
Yeah.
gotcha. Okay.
In fact, when you open it, but thank you for offering that. But no, and in fact, you have until the 2nd of December to get them completed.
Oh, okay.
So, yeah, no, I just wanted to let you know where they lived so you knew.
Perfect.
All right, so that's consent. The next thing I wanted to go over was the testing. It looks like when you spoke with the provider yesterday, she had uploaded in your chart an information sheet on egg health, and she also uploaded a document. It's called an IVF timeline. It's just helpful. It just kind of it gives you a visual of kind of how that kind of falls into place time-wise.
Yep.
It kind of brings you from like when someone notifies us of their day 1 to the retrieval. It's a nice resource.
Yeah.
So she had put that in there. Normally I would place in there how to upload something, but I knew you had uploaded things.
I did. Yep.
All right, so let me just pull in this requisition. Just bear with me for like just 2 quick seconds. I just want to take some of these off that you had. So you had a blood type. You had a CBC. Let me see here. I don't see a CMP. I'm almost done.
You are just fine.
I'm just making sure the things that you had tested, I take off the list so you won't have to repeat any of that.
Okay.
Because anything drawn within a year, we can accept.
Okay. Yeah, I was going to go with a local fertility clinic, so I did basically every test that they wanted within the last month. So most of the fertility testing should be good.
I don't see a complete metabolic panel. I see a CBC, but I don't see a CMP.
And one from the last year will work. I wonder if I have one from like a primary care doctor, maybe.
It can't be more
Okay. Okay, I
If
might
it's
have
a year
one.
or more old, we can't take it, so I have it on the list for you, but you can check it out. I don't see an anti-malarian hormone level, an AMH. That's something CNY.
That should be in there. The AMH test that I had done, I
don't
think I
have it.
uploaded. Okay, I'll upload that one also. It was low. It was
Yep.
0.22, so it's pretty low.
I don't see a prolactin.
Okay, and that should be
Yes,
in
I
there
do.
too.
Sorry.
Okay.
I see the prolactin. I don't see a testosterone, and we look for that. I don't see I do see that. So it looks like just a CMP, an AMH, but you're saying you might have had that, and a testosterone. I don't see those. And then the provider asked for a saline and dye test.
So going back to the
cavity and fallopian tubes.
Going back to the AMH, can you see the documents that Aya uploaded? Like under the Okay, and it's not there anymore. It was there yesterday. Okay, I'll re-upload that.
The person on the phone yesterday saw the AMH.
Yeah, she said she saw it yesterday, but I wonder if maybe it got hidden somewhere. I will re-upload it.
I'll go through it again. There's a lot to look through, but give me a second to I'll double check that before you go through the jumping through hoops to get it re-uploaded. But especially if you're saying someone you talked to yesterday saw it, so let me look at that another second. But I just want to look at. I pulled up the provider's notes, so I had to get out of where you had uploaded things. So she suggested preconception blood work, semen analysis, saline and dye test, antral follicle count, which is an ultrasound within the first 4 days of period.
Yep. So in that we had all of that done already. All of that's been uploaded, I think.
So saline and dye test.
So the saline sonogram I did, that's the CIS, right?
SIS, yeah.
Yep, that I did, and then I did a hysteroscopy. I did not do the gram.
To check the fallopian tubes?
I did not do that because I have a iodine contrast allergy, so they were going to skip that. And because the CIS and the hysteroscopy came back good, they were going to skip that one. I don't know if that helps any. Okay.
Okay, so let me go back, and I want to go to a different section where, let me see, there's a part where people can upload their previous testing, and then there is a section where the staff scans it, especially into the chart. So let me just look at the other version to see.
Okay.
I am looking for the AMH, right? That was what I didn't see the first time around. All right, let me just look now that I'm in here. So I see thyroxine, rubella, hepatitis B, RPR, varicella, a blood type, estrogen, vitamin D, CBC, hysteroscopy, thyroid, some hormone levels like FSH, LH. I've got the Hep C, prolactin, HIV, A1C, and last but not least,
there it is.
Okay.
We found it.
Sorry about that.
No, that's okay. I appreciate it.
I don't have that on the list, but I'm glad I went back and just looked again. So that is there. So that list now should be appropriate.
Okay.
And in your chart, and it would be found under documents.
Okay.
And the folder is called patient instructions, and that's where you'd find majority of the things, let's say, that we upload.
Okay.
All right, I just don't want to lose my train of thought. Want to let you know, it's just some informational things. Our physical offices, like most doctors' offices, close at 4. However, nurses on the clinical line that answer incoming calls, they answer from, and all this is pertaining to Eastern time.
Okay.
They answer Monday through Fridays from 6 a.m. to 8 p.m. And Saturdays they answer from 7 a.m. to 2 p.m.
Okay.
So we don't have coverage on Sundays, and so I like to play devil's advocate. I try to think of things that would happen to me that I'd be then, kind of panicked. So let's say you're to let us know, when your cycle day 1 day one of your period. And let's, of course, say it starts, Saturday after 2 or sometime Sunday when we do not have nurses on the phones.
Right.
Simply just call first thing Monday morning and just let the nurse know that your cycle started. But of course, if you need us by phone, during the week, even though our physical offices are closed, if it is something a nurse can help you with, you have up till 8 p.m.
Okay. That's good to know.
Questions for me?
I would basically, I plan to skip my next cycle, but then my one after that would start December 20th. So am I kind of on track and good to go to start with that December 20th cycle?
Yeah, my best guess is once you have everything wrapped up and, consents are signed and meds are ordered, you should be in pretty good shape.
Okay. And then am I correct in understanding that retrievals do not happen on Sundays? Retrievals are
Correct.
Monday through Saturday.
Monday through Saturday.
Then the only other question I have is my plan to do, and I talked to the lady a little bit about this yesterday, but given my age and the low AMH and the low, my follicle count is only 7, given that plus my age with the euploid statistics, we were kind of thinking about doing at least 2 retrievals in a row before we go on to the frozen transfer, just to kind of help with statistics a little bit. Is there any issue in doing the 2 retrievals, 2 different months in a row? Okay. Okay, perfect. Do you have any other questions?
Nope, I'm all set.
So I guess what is our next step? Obviously I have to sign the consents and the emails and then the other blood work that you need. Other than that, is that pretty much, I guess what's the next step?
Pretty much it. I would just make sure you peek at the next steps document just because it is a nice resource that kind of just lists everything out. But the easiest way for us to kind of, itemize it is wrap up testing, sign consents, make sure you send a message to the prescription team, and then simply give us a call with day 1.
Okay, perfect. So I will finish up the blood work and then send prescription a message and send financial a message then.
That sounds like a plan.
Awesome. And then
I hope this was helpful.
It was very helpful. Now, would you be kind of our point of contact going forward, or do you just kind of do the initial?
I'm just strictly a nurse on the Nurse Navigator team, so I'm one of the nurses that are just kind of helping explain the console, kind of what to do next. Your people that you'd be in touch with would either be the clinical line nurses or the global travel nurses.
Okay. Awesome. Sounds good. I appreciate all the information.
Thank you very much.
Oh, you're welcome very much.
Awesome.
Anytime.
Awesome. Well, thank you.
I wish you both the best.
Thank
Thank you.
Have a good day.
Thanks. You too.
All right. Bye.
Bye.
Bye. All right, guys. So there you have it. We have done all of our testing. We've gotten through our phone calls, and I also had to email financial, got our down payment taken care of, and then my meds have been ordered. They're actually supposed to come in 4 days. So I'm super excited. They'll actually overnight them, so they haven't even shipped yet, but I already have tracking information. But once they ship, they'll get here the very next day, and then we'll actually do an unboxing video with all the meds, because I think there's kind of a lot of shots.
It's
and
going to be very intense from what I understand.
Yeah, I'm nervous, but I'm also very excited, but nervous.
It's an exciting time, that's for sure.
Yeah, so stay tuned and be sure to check out our other videos. I definitely plan to keep doing more videos, and we'll keep you guys posted on how this all goes. Thanks for watching.